Welcome everyone to CCHI's webinar dedicated to implications and impact of Executive Order 14224. My name is Natalia Miteriva. I'm the Executive Director of CCHI, and our presenter today is one of the founding commissioners of CCHI, Mara Youdelman. Before we actually start, a couple of housekeeping items. First of all, if you need sign language interpretations, it is provided today courtesy of LanguageLine Solutions, and we have two wonderful sign language interpreters working. Make sure that you press interpretation button on Zoom. Now let me introduce a person who doesn't need any introductions. Mari Youdelman, managing attorney at the National Health Law Program, an advocacy organization on behalf of individuals who seek healthcare in the United States. And as I said, one of the founding commissioners of CCHI. And one other tidbit. Is that she's also a recipient of the Language Champion Award from the National Commission for National Council on Interpreters in Healthcare. My goodness, forgot NCHC abbreviation here. And I've been privileged of working with Mara since 2009 on CCHI, but several years before that, pre-CCHI as well. So it seems like this is a deja vu webinar of 2016 that when we were in the first iteration of trying to limit language access. So we are all curious and eager to hear what you could share with us today. After Mara goes through her slides, then I will be asking the questions that we received before and we'll continue that conversation. So Mara, take it away.
Thank you. Hi, everyone. We are good to go. Thank you to CCHI for inviting me to come and present today. I know that this is a topic of great interest. One caveat I do want to be very clear about, while I am a lawyer, I am not giving anyone legal advice today. I'm sharing information, I'm providing a summary, I'm providing you, my analysis, but this is not legal advice. And so if you have specific questions about how this might apply in a facility or an entity you work or for your organization, you're going to need to make sure you are consulting with your legal department or getting other counsel. So with that caveat aside, good afternoon. Again, I'm Mara Youdelman. I'm really happy to be with you all today. I wish I was talking about something, a little bit of a better news, but I think and hope by the end of what I'm going to talk about, you'll actually understand that language access is still the law, despite this new executive order. So what I'm going to do is go through a pretty, hopefully short legal and explanation of what this executive order did. I think it's really important that you understand what an executive order can and cannot do and where it fits within sort of other legal requirements. So again, I'm not training you all to be lawyers, but I want you to understand the scope of what President Trump signed in this executive order 14224 and what it means for language access. So first, if you're not familiar with my organization, we're the National Health Law Program, or NHeLP. NHeLP's been around for over 55 years, and we educate, advocate, and litigate to ensure healthcare access and quality of care for low-income and underserved populations. I've been at NHeLP for 24 and a half years now, and I started working on language access my second week there, which is when President Clinton signed Executive Order 13166, which now has been rescinded. But there's lots of information on language access available on our website. And so we do have information. I wrote a blog about this executive order, and I'll also share some other resources towards the end of my presentation. So let's get going. This executive order that many of you are concerned about and have seen coverage of in the news was issued on March 1st. It declares English the official language of the United States, and it revokes President Clinton's executive order 13166. That all sounds pretty frightening. But, and this is the big but that I really need you to understand, this executive order does not require or direct any change in the services provided by any federal agency or any other agency that receives federal funds. Further, the executive order specifically says that agency heads, so for example, the Secretary of the Department of Health and Human Services, is not required to amend, remove, or otherwise stop productions of any documents, products, or other services provided in non-English languages. The executive order does rescind policy guidance that was issued pursuant to this prior executive order, and the Department of Justice has rescinded its guidance. But again, as you'll see, as we go through my presentation, that language access is still the law. And this bottom quote is directly from the executive order. So the order recognizes and celebrates the long tradition of multilingual American citizens who have learned English and passed it to their children for generations to come. So if you're not familiar with the executive order that was rescinded, I just wanted to give a little bit of context here. This was signed in August of 2000 by President Clinton. It sort of reiterated longstanding requirements under Title VI of the Civil Rights Act from 1964. It also applied Title VI to federal agencies themselves. And it was issued right at the same time that the Department of Justice put out its LEP guidance. And then it required every federal agency to draft their own Title VI guidance. Some of you may be familiar with HHS's guidance, their LEP guidance. There's also guidances from all the other federal departments on the website lep.gov. This executive order said, the federal government's committed to improving accessibility of services for eligible limited English proficient or LEP individuals. So this executive order is now what's gone. But again, as you'll see, language access is still a requirement. Okay, here's my legal lesson for the day. It's only about 2 slides, so bear with me. I want to go through the hierarchy of law. And if you've seen my presentations on Section 1557, you've seen these slides before. But again, I want to reiterate what the issue is. So when we talk about the laws of this country, we're usually talking about a statute. A statute is, if you've seen Schoolhouse Rock, when a bill becomes a law, it's not exactly how it works in DC. Sometimes we wish it was, but both houses of Congress have to pass the same bill when the president signs it, and then it becomes a law. Once something is passed by both houses of Congress and signed by the president, you can't get rid of it unless you go through that process again. So an executive order can't overturn or repeal a statute. Once Congress enacts a statute, what often will happen is the federal agencies who are empowered with implementing that statute will develop regulations, puts a little bit more meat on the bones. So if you look, for example, at Section 1557, the non-discrimination provision of the Affordable Care Act, that statute, the law, is like 3 paragraphs. And it says, don't discriminate. Well, what does it mean to not discriminate? That's where the agency comes in. And many of you are probably very familiar with Section 1557 regulations. We've had 3 rounds of regulations. The regulations that were issued under in the last year of the Biden administration put some more explanation. They define what's a qualified interpreter, what's a qualified translator, what's a qualified bilingual staff. They talk about issues that need to be provided, like notices and information about auxiliary aids and services. Regulations also go through a pretty formal process. An agency will draft regulations. They do internal vetting within the agency, within other agencies, with the White House. They publish it in the Federal Register. There's a formal notice and comment period. Many of you may have participated in this or signed on to others' comment letters. The agency considers those comments and then finalizes the regulation. Once a regulation is finalized, the only way to change it or revoke it is to go back through that process. Draft something new, have a rational reason for making the changes, have public notice and comment, consider the comments, and then finalize it. The third sort of bucket under the laws, or we call them, is guidance. Guidance is sort of a step below a statute and the regulations. Guidance is developed by agencies. It's more informal. There's usually no notice, no public comment process, and that can be changed pretty quickly. Sometimes it takes the form of like frequently asked questions that provide more information. Like once the regulations are in place, maybe some questions came up. Well, what does this piece of the reg mean? Sometimes an agency will issue guidance to explain it. So if we look at language access in terms of this hierarchy, we've got two statutes already in place. We've got Title VI, again, of the Civil Rights Act of 1964, way back. And we've got the Affordable Care Act, Section 1557, which was signed into law in 2010, so 15 years ago. Both of those statutes have formal regulations implementing them. Again, we've had 3 sets of regulations on Section 1557, but the 2024 regulations from the Biden administration are still in effect. There also are Title VI regulations. These are older, so you might not be as familiar with them as the Section 1557 ones, but they work in concert with each other. Then this third bucket is where an executive order comes in. It's guidance. It states what the White House policy is and what it wants agencies to do, but it can't by itself change regulations or statutes. Let me repeat that. An executive order cannot overrule, revoke, rescind, or change a statute or regulations. That's the crux of what I want you to take away today. Other examples of guidance: frequently asked questions, the HHS LEP guidance documents on lep.gov. Okay, so we're going to go back in time a little bit more and give you some history. Title VI of the Civil Rights Act was signed in 1964. Here's a picture from that signing ceremony. Title VI is where the right to language access really got started. Title VI says if you take federal funds, you can't discriminate on the basis of race, color, national origin. And the Supreme Court and the Department of Health and Human Services have both said that language can be a proxy for national origin. So if you take federal funds, you can't discriminate on the basis of language. And based on what I just showed you about the hierarchy of laws, Title VI and its implementing regulations, still in effect. Nothing has changed. This is what we're trying to address in Title VI, right? Is to get rid of segregation, to get rid of discrimination, and to ensure that everyone had an equal access to federally funded programs and activities. Then we move forward to 2010 when the Affordable Care Act was signed into law. If you're familiar with Section 1557, and that refers to the section in the Affordable Care Act, because the Affordable Care Act is incredibly long. So Section 1557 is a broad non-discrimination provision, and it reinforces Title VI, so it protects against discrimination on the basis of race, ethnicity, and national origin. It also protects against age discrimination, disability discrimination, and sex discrimination. Again, nothing has changed with Section 1557. And as I mentioned before, we have final regulations implementing Section 1557. These came about, almost a year ago. And there's these definitions. So you can look to see what the federal government says, how it defines national origin, an individual with limited English proficiency, language assistance services, relay interpretation, companions, qualified interpreter, translator, etc. So this is just one example here from these final regulations. And if you want more on these regulations, I did a webinar for CCHI previously that outlines lots more specifically about this regulation. So you can go back and watch that if you want more details, because I'm really just touching like at the 10,000 foot level and barely even at that level. Just as a reminder, what these regulations lay out is a general requirement when a recipient of federal funds or a federally funded health program or activity is meeting the needs of limited English proficient or LEP individuals. The focus has to be on the individual served or likely to be served. The entity has to take reasonable steps to provide meaningful access. And then the Office for Civil Rights, or OCR, is going to look at, what's the nature and the importance of the health program or activity and the communication at issue. You all know that when we're talking about healthcare, Virtually all these encounters are pretty darn important and significant, and you're going to need to have competent language services involved. They'll also look at other relevant factors like the effectiveness of a language access procedures and things like that. And again, to reiterate, under Title VI, Section 1557, the current law of the land, language access has to be free, accurate, timely, protecting privacy, and you have to use qualified individuals to provide language services. There's a lot of other requirements in the Section 1557 regulations. This, again, is really just a sampling, but this really does explain how do you make sure you aren't discriminating? Because it's great to say we have civil rights laws and don't discriminate, but if you don't know what that means in practice, in a healthcare facility, in a clinician's office, in a health center, in a hospital, that's what these regulations try to provide more explanation on. So again, if we go back to what I was talking about at the beginning, nothing has changed with Title VI. Nothing has changed with Section 1557. Nothing has changed with these regulations. We do have a new executive order, but it can't on its own get rid of these other requirements. So in addition to what's happening at the federal level, you may have state laws that govern language access. I just want to mention that because I think it's important to understand that. We did a survey, it's about 6 years old already, but we looked at state language access laws and regulations related to health and language access. So you can look at that. Every state has their own state laws. Some states have very comprehensive state laws, like a Title VI lookalike, a state law that says you can't discriminate if you receive state funds. Others may address specific sectors, maternity care, substance use disorder treatment, things like that. But you may also have state laws in addition to federal laws. So as I'm wrapping up, I just want to again reiterate, and I know I'm saying this over and over, but I think it's really important to understand. Executive orders can't overturn existing statutes. To do that, Congress would have to pass a new bill and send it to the president to sign it. Executive orders on their own also can't overturn existing regulations. The only thing that executive orders can do is rescind prior executive orders, like we saw in this one, and it can rescind guidance. And it can tell you what the intent or the policy is for the federal government, but unless they go and make other changes, those regulations stay in place. So this was the title for the blog I wrote on this topic, that despite a new executive order, language access is still the law. So again, Title VI and Section 1557 remain the law. The regulations remain in effect. Now, I think one set of questions comes in is, well, what could this administration now do? The administration could decide to make revisions to either the Title VI regulations and or the Section 1557 regulations. But it can't do that just by itself. It would have to draft changes, go through an internal clearance process, publish them in the Federal Register, have a public notice and comment period, in which case we'd give you lots of information about how to weigh in, as we've done in the past. We've provided template comments, we've provided a comment portal, we've provided instructions for how to weigh in. The administration would have to consider those comments and then finalize a new regulation. It can't happen overnight. It usually takes, over a year from start to finish. Furthermore, once regulations are finalized and published by the government, they can be subject to litigation. And certainly under the prior regulations, both from President Trump and President Biden, lawsuits were brought. Many of those lawsuits focused on the provisions related to sex discrimination and not language access. But again, even if we get new final regulations from the Trump administration in the next year or so, that's not the end of the game, and they might be challenged in court. So I'm leaving you with a bunch of resources. Again, our website has a lot of information about Section 1557 and Title VI. And I'd say if you're getting questions from the entities where you provide interpreting or where you work, we actually also have like a question and answer on Title VI and Section 1557. And again, nothing has changed with that. So I'm going to wrap it up there and ask Natalia, and we'll start with questions.
All right. Well, thank you for this overview that sets the stage for the questions that we've collected. And I want to start with the kind of policy questions first, and then go some other, topics. In connection with what could happen next, what legal challenges exist or might be pursued against this actual order 14224? Can it be, challenged in court now?
There certainly have been lawsuits against some of President Trump's executive orders already. A lot of them have focused on the orders that prevent the provision of gender affirming care, that have resulted in firing of federal workers, that have limited the definition of sex to male and female. The list goes on. At last we looked, and this is probably 2 weeks old, there were over 124 lawsuits filed against various things that the Trump administration has done. Some of those are challenging executive orders, but I think because of what I described, it's unlikely that we may see a challenge to this executive order because, again, it doesn't change anything specifically.
Understood.
So some of the others actually change the federal government's policy by defining sex, which isn't defined elsewhere. Because this executive order rescinds a prior one, which you're allowed to do, but it doesn't sort of try to impose new policies or requirements, I don't expect at this point that there will be a legal challenge to this executive order. Again, if we see changes start to happen within the Department of Health and Human Services or other agencies, then there might be litigation about those specific changes.
Okay. And how does this executive order conflict, or does it, with the First Amendment rights? And also taking into account by announcing English as official language, uh, do you see that is does it infringe on freedom of expression?
I'm not a First Amendment lawyer. I did learn about it in law school, but this executive order doesn't limit anyone from speaking about language access, from training about language access, from providing language services, or speaking in a non-English language. So there shouldn't be any impact. By designating English as the official language, that's for government functions, and the reality is we've been operating under that way. That's not a change how the government works. They work in the language of English. The Federal Register is published in English. Policies and procedures are published in English. Grant proposals are published in English. So there shouldn't be any implication from a First Amendment perspective. And again, if we look back at the language of the new executive order, it says that agencies still can provide information in non-English languages.
And in connection with what that order says, it references American people in Section 3B there, and does that reference to American people suggest that undocumented language patients with limited language English proficiency may be excluded from language services because providing those services could be seen as inefficient or contrary to the agency mission?
No.
That's a good answer.
Here's why. Title VI and Section 1557 says you can't discriminate. Now, it doesn't talk about immigration status, so let's not focus on that. But it says language can be a proxy for national origin. You can't discriminate on the basis of national origin. So you can't exclude someone who's limited English proficient from your hospital. You can't turn them away and say, we're only going to treat you next Tuesday if you treat all the other people who come in that day. all those same expectations and requirements under Title VI, under Section 1557 still apply.
But do you think there still could be some chilling effect on people because of this executive order? And how, in general, do you think it may affect immigrants or undocumented individuals, or especially those when they interact with such agency as ICE?
Sure. There is a huge chilling effect going on, and more than a chilling effect going on against immigrants in this country, including, numbers of them who have been disappeared, sent to prison in El Salvador, not given their due process rights. I'm not sure this executive order is the one that's tipping the scales for people, to be honest.
Hmm.
But that said, I think it is our job as people who advocate for language service or provide language services that we continue to educate providers, the public, our clients and patients, and the healthcare system at large, that again, language access is still required. Nothing has changed. There certainly are bad actors out there. I can't promise that every covered entity is going to do what they should be doing, but that's been the case forever, unfortunately. That really hasn't changed. So I think we do have to make sure people know, in terms of language access, they have a right to it. They should request it if it's not provided. And again, all the requirements, if you look at the Section 1557 regulations, still apply. That said, we're living in a time that is very frightening for a lot of people in this country, but in particularly immigrants and undocumented immigrants, because of the policies of this country to, arrest, deport, and disappear individuals. So it's certainly related, but I think honestly that this executive order is probably not what is worrying most undocumented people and even other immigrants who are here lawfully, but feel that they're at risk now. I'd say
Thank
that's a
you.
whole other webinar.
I know. It definitely is. It's a topic that is definitely affected by language, but not exactly, directly related to this executive order.
And
Um,
Natalia, maybe you can mention the joint statement or document that was put out by a number of organizations and CCHI signed on to it. Maybe we can post that in the chat so folks can see that, about, some general information about what to do if ICE comes in to where you're interpreting, and that you can speak better to that than I can.
Yes, absolutely. As far as interactions with Isaac, a couple of organizations have published already the recommendations for interpreters. CCHI will post it on our website, but recently we have signed on to the statement saying that several associations and CCHI oppose this executive order, and I'm putting in the chat right now the link to that statement where you could see what that statement was like. And if you belong to an association that is not listed there yet, feel free to reach out to us. We can update that document and add it to that joint opposition to this executive order. But back to what the previous executive order kind of ensured, part of it was actual support of the organizations that provided and giving them kind of a roadmap, guidance. So who will bear the cost of interpretation services now? The institutions and insurance company? Or do you think that because of that, because of the lack of desire to actually be proactive in language access, more and more language patients themselves will have to pay for interpreters on the side, behind the scene, etc., because they'll be too afraid to ask for interpreters?
Well, the law is clear that language services must be provided by entities receiving federal funds, and that they can't charge patients or clients. What patients or clients choose to do is sort of a different analysis. So I think, again, the more we can do to educate and inform about what the law says, that's really where we can continue our focus. I mean, individuals always have the right to, bring their own interpreter. Um, Covered entities need to make sure that that person is qualified to interpret, or they can get into trouble because it might cause other issues. And one of the resources I have on my slide is a report we did a number of years ago that looked at the high costs of language barriers in medical malpractice and negligence cases. Um, so again, I think what's required is easier for me to say. How people choose to react is very different.
Definitely. But back to still like the implications of this order to other organization, do you think that accreditation requirements, healthcare accreditation requirements for language access by the Joint Commission will be affected? Or do you know of anything that the Joint Commission could have to react in connection with this executive order?
I certainly haven't heard of anything, and I can't speak on behalf of the Joint Commission, but often when they revise their standards, they also do go through a public process and they get input from the public before they finalize their standards. So I would expect before they make any changes that they would go through their normal processes. That said, people are probably also familiar that there have been executive orders um, addressing DEIA, diversity, equity, inclusion, and accessibility. And there have been, some attempts by the Office for Civil Rights to go after, at this point, some hospitals or medical schools for considering DEIA in their admissions, not in their patient care that I'm aware of. So it's certainly possible. And again, then it would be up to the Joint Commission to decide what they do. But for now, the Joint Commission standards remain the same. And I believe it's a requirement of hospitals and other providers who want to participate in Medicaid and Medicare. There's something called conditions of participation, and accreditation is required. It doesn't have to be by the Joint Commission, but obviously the Joint Commission still has standards.
And something that you said brings up another question. So when ho- inside the hospitals, right? Whether will there be any effects of this if the language services were under this DIA department? Could they close language services because they're trying to comply with that, you know, uh, pressure to get rid of the diversity, equity, and inclusion field?
Again, executive orders addressing or prohibiting DEIA cannot overturn the requirements of Title VI and Section 1557. It's that same analysis.
Okay.
So if language services happen to fall under a DEI office and the hospital is getting rid of the DEI office for reasons it decides, it still has a requirement to provide language access. So that office language services should be moved somewhere else and not merely eliminated.
Okay. And do you see there'll be any effect on workers' compensation cases, Medicare, Medicaid patient under this provision? Because these are dealing more, I mean, workers' compensation may be state related, but Medicare, Medicaid are federal programs.
Again, in terms of Medicaid and Medicare, Title VI and Section 1557 apply. Those programs provide federal funds to healthcare providers, clinics, facilities, and hospitals. So any entity that's receiving Medicaid or Medicare funds has to comply with Title VI and Section 1557 and should still be providing language access. I recognize, even though we've been advancing language services for decades, longer than I've been in NHeLP, and we still have a ways to go, it is going to be a more challenging climate right now because people may not understand everything that I've just talked about, or may have concerns or fear or, not really know how they should proceed. And so again, I think it really is important to do this education and make sure folks know really nothing has changed with the law. There's still a requirement to not discriminate. There's still a requirement to provide language services. That one piece, Natalia, I do want to just clarify, and it might be one of the questions you're going to come later, but um, most of what I've been talking about is healthcare. That's where my area of expertise is. Obviously, CCHI, Certification Commission for Healthcare Interpreters. Um, but I do want to talk a little bit about other federal agencies. So Title VI says if you take federal funds, you can't discriminate. Title VI technically, in the narrow legal sense, doesn't apply to federal agencies themselves for their activities. So let's look at, let's take Medicare, for example. Medicare is run by the federal government. Title VI did not tell the Centers for Medicare Services, you need to make sure your documents are translated, or you need to provide language services. Medicare providers, hospitals, doctors, clinics, etc., had to provide language services, but the federal agency itself, it's just a weird loophole of what counts as federal funds. So when we were working with others to get Section 1557 included in the Affordable Care Act, we were very clear that it says health programs administered by federal agencies can't discriminate. So that includes Medicaid, it includes Medicare, it includes the marketplaces. Executive Order 13166 from President Clinton also said Title VI applies to the federal agencies themselves. But now that we've lost that executive order, and in many agencies, if they are not operating a health program, then technically the agency itself isn't subject to Title VI. But again, this new executive order still said an agency can do something. It's just not legally required. So in the health realm, because of Section 1557, we have stronger protections. In non-health federal administered programs, not funded outside the federal government, federal administered programs.
And just
That's
to
where
clarify, we're talking about Department of Justice itself and its publications, Department of
Department of Homeland
Education,
Security,
of
Department of
Homeland,
Education.
exactly,
Yes.
those three, that if they choose not to provide any information on their website in languages other than English, technically they can.
But once they start giving money out, so when DOJ gives money to the courts or to prisons, when
Mm-hmm.
Department of Education gives money out to the schools,
Mm-hmm.
once those schools take the federal funds, once the courts take the federal funds, Title VI applies to them and they have to provide language services. So I realize this is a little weird, but I just want to make sure that that's clear because some of you may work out, beyond the health realm.
Absolutely. Many of interpreters, especially freelancers, work in different settings, and that is an important distinction. That, unfortunately, what that rescission of that order means is that the public interface of those federal agencies could remain just in English. It doesn't have to. It may still continue to have different things, but it could be like, for example, the Office of Civil Rights used to have this I speak cards, etc. And then they disappeared. I don't know if they reappeared yet, but they disappeared from the website. And so that's the weakness in the system because of that new executive order. Um, does it have any immediate effect of provision of language services for the deaf and hard of hearing?
No, I mean, those are covered under different laws.
Mhm.
So if we're talking about individuals with disabilities, we still have Section 504 of the Rehabilitation Act. We have the Section 504 regulations that the Biden administration finalized. And we also have the Americans with Disabilities Act. None of those, again, have changed. And the executive order didn't directly address them.
Okay, that's at least good news for one section of our world, language world. Do you see any immediate threats, and if you do, what they could be, that this order poses to language service providers? business operations to interpreters working on the ground as, freelancers, staff interpreters?
I think again, it's going to be incumbent upon them to help educate the entities that they work with about what is and isn't expected and required and what is still the law. So there may be some extra steps. And there may be some entities who say we don't have to provide language services anymore. And I think, again, we're going to have to work on making sure that that education happens.
Mhm. Um, and now question maybe slightly, I mean, not related to this, but still is in this day of uncertainty. We received questions about, um, do you think that because of this executive order, there will be more push and more acceptance of AI tools replacing human interpreters because they could be viewed as, you know, a cheaper way of providing language services? And do you think that will still meet the definition of meaningful language access and provisions of Section 1557, specifically in healthcare?
Or I think it's a little bit apples and oranges or, running on parallel tracks. AI is certainly an issue that has come up before this executive order, and it will continue to come up after this executive order. The Section 1557 regulations that were issued under President Biden have a very strong provision about the use of AI. And it says, for information that's really critical or important, I forget the exact wording, I apologize, but you can't use AI unless there's a human translator involved, because of the fear of inaccuracy. And the same, I would say, applies to interpreting. Um, so certainly there, we've certainly heard of healthcare facilities who would like to move to AI. And AI isn't there yet. And, I use the example, both of my kids were in Spanish immersion starting in kindergarten, and I don't speak Spanish. And so we'd get homework coming home. And, in second grade, they start the word problems. Jimmy has 10 balloons. He gives 3 red balloons to Susie. How many does he have left? And this is coming home in Spanish. And I can't understand this and help my kids. So I use Google Translate, and it wasn't doing it accurately. If Google sorry, I shouldn't impugn, it's not just Google Translate. There are other AI systems out there. But if it can't accurately translate a second or third grader's homework, we should not be using it in a complex medical setting. And it's gotten better. I fully am aware of that. It's not yet where it needs to be. And I don't know if it will get there, to be used in healthcare settings with complex interactions with technical language, with medical terminology, with trying to explain informed consent or diagnosis and options for treatment. Um, we really, really need to make sure that the problems with AI are explained again and brought to the forefront. And people can use examples. The other example came, examples abounded during the COVID-19 pandemic. We saw state health departments put a widget on their website to automatically translate, their English website into non-English languages. And even in Spanish, which, is supposed to have a higher accuracy rate because of the frequency of use, Virginia Department of Health's website, instead of saying you should go, get a vaccination, said you do not need a vaccination. That was the translation. And there's other examples of that. So AI is not sufficiently accurate. And I'd say under the 1557 regulations, there's the AI provision, but also clearly you need to have a qualified interpreter or a qualified translator, and AI would not meet those requirements.
Thank you. And just for the audience, I want to remind that the NCIHC has published a guidance on AI and working with AI in the context of healthcare interpreting. So please refer to their website to and familiarize yourself with. It's an excellent document. And to follow up on that previous question, we got an additional question in the chat about that, Section 504, that it's currently being undergoing a broader challenge. Do you know anything about it? Could you comment on it, on uh, the challenge that the current administration is putting on it?
The five, sure. Section 504 of the Rehabilitation Act is similar to Title VI. If you take federal funds, you can't discriminate on the basis of disability. The Biden administration issued the first update to 504 regulations in, I think, 50 plus years. And there are court challenges against it. In part, the court challenge was focusing on provisions related to, excuse me, gender dysphoria being defined as a disability and thus, covered under Section 504. But the litigation that is challenging that regulation went beyond that provision and attempts to eviscerate all of Section 504 and say it's unconstitutional. That litigation is still working through the courts. But again, at this point, Section 504 is still the law, and those regulations accept the provisions challenged under under the litigation. And I don't know the exact pieces there. Some of the regulations might not be in effect. They might be on hold by the courts.
Okay, thank you. Um, Now, is there a potential or an opportunity here to try to look at this executive order on the opposite side? Do you think there's something that could be done now that could lead to better regulation of interpreting services or certification requirements? Or do you think this is just trying to find some silver lining where there is none?
Well, I mean, if we look back to the 1557 regulations put out by the first Trump administration, they still included requirements for language access. So again, we have to wait and see if they revise the current regulations, what they do. But again, I think that continuing to educate what the current laws are, why certain people need language services, who the people are who need language services. Many of them are refugees and asylees who've recently come into the country. Some of them are citizens. Depending on where they live in the country, English might not be their first language. There's other reasons also why it's very hard sometimes with a disability to learn English. We're not going to get to a point where no one, even if everyone is working to learn English, there's still going to be a period where they need services. And we're talking about access to healthcare, which can have life or death consequences. We need the communication to be effective. We need the communication to be complete and accurate. And so again, I see it as we just need to continue our work to do the education to really help providers, facilities, the public understand why language access is so important.
And to continue your appeal to all of us, still continuing to educate everyone around us, and in situations where somebody may misinterpret the intent of the executive order, um, do you have any suggestions about strategies of language access? Do we need to have some kind of other actions besides educating on the local level? So, any recommendations
Sure. I mean,
about
certainly,
advocacy?
right. Certainly, I mentioned state law. And so you can look at what your state laws require. And you can examine whether there might be additional laws that make sense for your state to adopt. And it can be a state statute, it can be a state regulation, it can be a local ordinance or a local proclamation supporting language services or supporting interpreters. I think there are a variety of ways to do this. It could having a language access day recognized and, using that as a public messaging to explain why language services are so important, why qualified interpreters are so critical for effective communication. Those are just a couple off the top of my head.
Thank you. Yes. And I think it's also important to post stories, right? About, situations where interpreters helped with people's lives, family situations, etc. And when you were mentioning that, need for languages will not disappear if everyone starts actively learning English right now, we also unfortunately forget that with age, certain conditions like Alzheimer's could cause you reverting to your first language or native language, even if you had spoken English for decades living in this country. So, and there are many more and more nursing homes and long term facilities that require interpreters, not because those individuals didn't speak English, it's just because our brains. Age in a different manner. So that's another thing that affects everyone. And, I live in Ohio, so Amish country is two steps away, and they do not speak English to each other. And when they come to our, Akron Children's Hospital, they do need interpreters for the Pennsylvanian Dutch or German that they speak. So, and they've been in this country for over 200 years. So it's not just about individuals who move to the United States, but it is about people who live in this country. Um,
And sorry, I took off the screen because I'm trying to put in a link. Someone asked, "Is there materials?" But I put in NHeLP's website, and I think this sort of Q&A that I just posted about what's required under Title VI and Section 1557 is probably our broadest and easiest to access document. It doesn't specifically talk about this executive order, but you could combine it with the blog that I wrote that I'll paste as well, and use those as a combination.
Yes, and one thing I want to let everyone know is that once this recording is available on YouTube, CCHI will also have a web page available dedicated to language access resources that are important in the current situation. So we'll have more information available, and we'll send an email to everybody, both who groups that who registered for this webinar, but also to our general subscribers list. Um, Probably one of the last questions I want to touch on is can you alluded that there may be some state laws that already are that are either replicating Title VI or have described and defined language access. In general, could this executive order have effect on the state laws, or eh, are they completely separate?
Right. Again, for the reasons that I talked about, an executive order can't overturn a state law. Now, if there ends up, I mean, let's go to the law again. Sorry, I'm a lawyer, but if you have a direct conflict between a federal statute and a state statute, usually on particular topics, the federal law is going to rule. But in this case, when we have an executive order, which really is seen as the policy of the administration and can't change federal statutes and regulations, it also can't change state statutes and regulations. And I'd say on the reverse, there are a number of states, I think I don't remember the number, that have their own state laws that say English is the state official language. And again, you have to read that in concert with Title VI and Section 1557. And even if English is the official language for government business or for the state, they still have to provide language access under Title VI and Section 1557. So we've seen states that have had a similar executive order for years, and it doesn't change any of the requirements to comply with these federal laws.
And we, I think, all now got the understanding that the statutes cannot be repealed by the executive order. But what could happen that would repeal the statutes? Is there any intent, at least to your knowledge, to repeal the Affordable Care Act?
There certainly are attempts right now to change certain provisions of the Affordable Care Act, but we've not seen any specifically on 1557.
Hmm.
There's issues about the subsidies or the tax credits that people use and whether or not, some enhanced funding that's been available for a couple of years will go away. There was recently a proposed rule put out by the Centers for Consumer Information and Insurance Oversight to change some marketplace rules. Didn't address language access. So again, could Congress decide to do something? Yes. And we'll certainly monitor and let people know if something is going on. And this administration could choose to change the Section 1557 or Title VI regulations. Again, it would have to go through a formal process with a public comment period. And we'd let folks know about that and ask you to weigh in with your opinions and your thoughts.
And is there a newsletter or some way of subscribing to the updates that we could get about that from the NHealth or?
So NHeLP does have a general alerts email. You are welcome to sign up for it, but I will let you know that we do a lot more than language access. So you'll get a lot of information about the Medicaid program, about marketplaces, about our work on sexual and reproductive health, disability access, et cetera. So I certainly welcome you all to sign up. And I would say if your focus really is language access, make sure you're on CCHI's listserv, make sure you're on NCIHC's listserv, because when stuff happens that's relevant, I definitely make sure I forward it to them and help get the word out.
Yes, definitely. Well, um, thank you. We haven't exhausted all the questions that received, but I hope we touched on most themes of those questions. And we definitely thank everyone who attended today's webinar. And as Mara said, CCHI will continue informing you of all the developments related to language access, whether positive, negative, or anything in between. And if at any point we all need to have some specific actions to, react to certain changes, we'll definitely let you know and hope that you would, continue for following us. With that, thank you everyone and our wonderful sign language interpreters. I hope that individuals who needed your services also enjoyed this webinar and had a smooth experience. So thank you, everyone. Have a good rest of the day and week, and just hope you have enough information now to dispel any panic that could happen in the local level and just do the job that we do, making people who don't speak English heard, their concerns heard, and giving them access to services as any person in this land is entitled to. So thank you, Mara.
Thank you so much for having me, and thanks everyone for joining.